The virus in Canada, but new signs physical distancing is making a difference.
There are sacrifices we're all making, but it's beginning to work.
The new restrictions Ottawa is imposing on domestic travel. Watching and waiting. Hundreds of Canadians on board a coronavirus-stricken ship sit in limbo. One death every 17 minutes. The alarming numbers in New York as the U.S. struggles with surging cases. Plus, a famous British inventor swaps making vacuums for ventilators.
Country roads.
And how a group of friends across the country is filling time with Canada's favorite pastime.
Global National with Robin Gill. Reporting tonight, Colleen Christie.
Good evening. Thanks for joining us. Social distancing is making a difference in the fight against COVID-19 in this country. Prime Minister Justin Trudeau thanked Canadians today for the sacrifices they're making, but he said it's no time to get complacent. Here's why. As of right now, more than 800 new cases have been confirmed across the country. That brings the number of people who have tested positive to more than 5,500. More than 60 people have died. That's more than the number of lives lost during the 2003 SARS outbreak. Once again, Quebec saw the biggest daily spike at 477 new cases and 4 more new deaths. Every province and territory except Nunavut has detected the virus. And as you can see, the numbers are going up right across the country. Quebec, Ontario, Alberta, and BC are the hardest hit. The Quebec government is restricting non-essential travel in and out of 8 regions of the province. But as Abigail Beeman reports, the federal government is also putting limits on domestic travel to curb the spread of COVID-19.
We need you to continue to stay home.
Justin Trudeau is encouraged by the early evidence out of BC that shows physical distancing may be working. But the Prime Minister says people need to keep doing it, and he's tightening up on travel.
As of Monday at noon, people showing any signs whatsoever of COVID-19 will be denied boarding on all domestic flights and intercity passenger trains.
It's inconvenient, but I think it's necessary to slow this thing down.
It makes me feel a great deal safer.
It's obviously a drastic measure, but it's a pretty difficult situation we're in.
It will be up to companies to provide health checks for all boarding passengers by asking questions and looking for symptoms. Anyone turned away can't try again for 14 days unless they provide a medical note showing the symptoms aren't connected to COVID-19.
Governments, companies, and so on can put whatever measures in place. They're never going to be foolproof. Someone can hide symptoms and so on, take a Tylenol if they do have a fever. So I think at the bottom line, it really is, the collective responsibility.
There's actually opportunists out there trying to gouge the people. I'm coming after them with vengeance.
Ontario's premier is talking about collective responsibility too, announcing tough fines and even jail time for price gougers. There's even a snitch line.
If you're selling face masks, protective gloves, cold medicine, hand sanitizer, and disinfecting wipes, and you're hiking the price 5 times, 10 times what it should be, you're done, you're gone.
That equipment is badly needed, especially personal protective gear for those on the front lines. On Saturday, the Chinese embassy tweeted this photo announcing a donation in gear. Canada sent supplies to China last month. The embassy tells Global News those supplies arrived in Toronto on Friday. On Thursday, the Prime Minister said millions of items of gear would be arriving in the coming days. Health officials couldn't say when, but stressed to the public it should be saved for frontline healthcare workers, not people who want to wear a mask while grocery shopping. Abigail Beeman, Global News, Ottawa.
The Prime Minister says his government is in contact with counterparts in Panama, working on a way to help Canadians stranded on board a cruise ship. More than 240 Canadians are passengers on board the Zandam, anchored off the coast of Panama. At least 150 passengers and crew have become infected with COVID-19. 4 people have died. A government source tells Global News none of the deceased are Canadian. An Ottawa area couple on board tells Global News they're holding out hope they'll be among the passengers transferred to another cruise ship. Otherwise, they may have to wait until there's another way home.
And they've started last night and again this morning from 9 o'clock. they're moving about 60 guests per hour. And they're saying that this is the second group, and there will be a third and maybe final group later on this afternoon or maybe tomorrow. We're just hoping to have that letter slide under the door.
The couple says first priority to disembark was given to passengers in windowless cabins and those over the age of 70. In Ontario, an 18-year-old McDonald's employee is facing multiple charges after she allegedly faked a doctor's note saying she had COVID-19. The McDonald's was forced to shut down on Monday and send all of its employees home to self-isolate. The public was alerted and the restaurant was sanitized by professional cleaners. Police believe she was trying to get out of work.
It's disgusting. What human being would do stuff like this? We're in a crisis, and they're going out there and lying and putting people in jeopardy. It's disgusting.
The woman is facing charges of mischief, fraud, and making and using a forged document. The federal government has brought in a number of measures to help flatten the curve, but it's still resisting calls to implement what it calls its last resort. Well, now a former member of the Trudeau government says it's time to bring in the Emergencies Act. Mike LeCouture is hosting the West Block this week and has more on that. Mike.
Colleen, as provinces across the country impose stricter measures to keep people at home and to keep people from gathering in groups, the federal government is firm that it is not time to invoke the Emergencies Act. Prime Minister Justin Trudeau maintains that move is not off the table, but he also says it's a last resort. However, a former member of his government believes the time to do it is now. This week on the West Block, retired Lieutenant General Andrew Leslie applauded the federal and provincial governments for the work that they've done so far, but he's concerned about reports saying medical teams are running short on supplies like masks and ventilators. He believes a federally coordinated response is now necessary.
The Emergencies Act, I believe it's important, vitally important, that it be implemented now. Currently, the provinces are leading the fight against an unseen enemy that's trying to kill us and succeeding. That fight is going to have to spike in intensity. And of course, the time to introduce all the measures that are available to the federal government to provide that national leadership in terms of corralling the provinces and helping them between and amongst one another is before we get to the absolute crisis point.
Leslie believes that crisis point is still a few weeks away, and that's why he believes the government should stop wasting time and get ahead of this virus. Colleen?
Mike LeCouture in Ottawa. Mike, thank you. And you can see the full interview on the West Block, hosted this week by Mike LeCouture. That's tomorrow on Global. The U.S. is now the world's epicenter of the COVID-19 pandemic, and cases continue to multiply there. Tonight, there are more than 121,000 confirmed cases throughout America, and more than 2,000 people have died. The situation in New York is critical. Hospitals there are overwhelmed, and soldiers have been sent in to help. And tonight, 800,000 physicians signed and sent a letter to the American president saying social distancing must continue in order to save lives. Jennifer Johnson has more.
In hard-hit New York City, a grim statistic. On Thursday and Friday, COVID-19 killed New Yorkers at a rate of 1 every 17 minutes. The situation so severe, U.S. President Donald Trump is considering a quarantine on New York, New Jersey, and parts of Connecticut.
Some people would like to see New York quarantined because it's a hot spot. This would be an enforceable quarantine.
The U.S. Navy hospital ship Comfort will dock in New York Harbor Monday with more beds, doctors, and supplies. Still, some New York residents are trying to flee. Police are on alert along the U.S. East Coast.
I feel bad that New York is getting such a bad rap sheet when it's really all over the place.
New Yorkers coming into Rhode Island are being stopped and registered with the National Guard.
It's what I know to be necessary in order to keep Rhode Islanders safe.
New York is still facing a severe shortage of ventilators, masks, and other essential supplies. Healthcare workers fearing for their lives.
We already lost our first nurse in New York City. We're going to lose more.
Under an emergency order, the Pentagon is reactivating former troops and deploying them to hard-hit regions. New Orleans, Detroit, Chicago, and other metropolitan areas are all facing an overwhelming increase in COVID-19 patients.
There is no congregating allowed.
Doctors in hospitals across the country are being forced to make gut-wrenching decisions: who will get a ventilator and who will not. Terrifying for patients.
I felt like my lungs weren't expanding. You feel the sensation of drowning.
COVID-19 tests remain in short supply, but the federal government has just given emergency approval for a rapid COVID-19 test with results in minutes.
That enables the healthcare provider to see a patient, diagnose a patient, and take the necessary interventions in a very short amount of time.
50,000 rapid tests a day are expected to be produced starting next week. Some good news as this virus continues its deadly spread across America. Jennifer Johnson, Global News, Washington.
And the COVID-19 pandemic passed two grim milestones in Europe today. More than 20,000 people have died on the continent after contracting the virus. 10,000 of those deaths were in Italy. As dozens of countries struggle to get a grip on the crisis, the lockdowns are expected to become even more severe. Redmond Shannon explains.
This is the latest tool the Spanish government is using to try and slow down the spread of the new coronavirus. Thousands more people will likely die, so this work is all about mitigating the misery of the coming month.
Les anuncio que el gobierno de España
Prime Minister Pedro Sánchez has guaranteed full wages to all non-essential workers who stay home over the next 2 weeks. On Friday, Pope Francis delivered perhaps his most surreal Mass since being elected pontiff, praying for an end to the pandemic in an empty St. Peter's Square. A very different service in Italy's north. This church is full that is, of coffins. The priests opening their doors as a makeshift morgue. No one could take care of these people, said Father Mario Carminati, so we leave them here in the house of God for him to look after them. Some Italians are still not getting the message about the importance of lockdowns, with police lecturing drivers over unnecessary journeys. There are similar bans on public gatherings across the continent. Berlin police controlling people's movements in ways not seen since the days of East Germany's Stasi secret police. The scene is no different in London, where this enormous convention centre will soon open as a 4,000-bed hospital.
I've developed mild symptoms of the coronavirus.
Prime Minister Boris Johnson remains isolated with the virus, and like so many, he is now working from home.
But I think the one thing this has reminded us is that no one is immune, and that is precisely why we ask people to follow the government advice.
The British government is scrambling to get 20,000 new ventilators in the coming weeks. A communications mix-up meant it missed out on a chance to join a European group purchase. Instead, it's dealing directly with companies like vacuum makers Dyson and Formula One racing teams to build the units in time to save lives. Redmond Shannon, Global News, London.
There are early indications life is slowly returning to normal in Wuhan, China, where the coronavirus outbreak began. Today, 11 million people are allowed to leave their homes for the first time since the lockdown began 2 months ago. More than 60% of all cases in China occurred in Wuhan. But out of concern for a possible second wave of the virus in China, movie theaters across the country have been ordered to re-close. Coming up, what a difference an outbreak can make, how the pandemic is impacting the Canadian real estate landscape. Dropped its key lending rate this week, which led to a drop in mortgage rates. But as Robin Gill reports, the industry isn't responding and realtors are being forced to adapt.
The for sale signs may be out, but most open houses are closed.
Welcome to this incredible sub-penthouse.
Some realtors are turning to virtual tours to lure buyers.
I'm only doing virtual tours of properties that are vacant. I'm not even listing my clients' properties who live in their homes, so I'm very cautious about how I'm working in this environment.
Spring is usually the busiest time to buy and sell property. Now the industry is preparing for a downturn.
If this all settles over the next little bit here, that summer and fall might just be a bit
busier. What a difference a virus can make. Before this health crisis, sales were booming in Canada's two hottest markets. In Vancouver, overall home sales in February were up 44.9% from last year, and a huge jump, 36.9%, from January. In Toronto, overall home sales in February were up 45.6% from a year ago, and up 14.8% compared to January.
We will have a, what we call a recession, but really it's a health crisis.
Economists predicted real estate would be strong in 2020, but they're being forced to change their forecast.
There's going to be fewer sellers in the market, and there's also fewer buyers as well, right? So you have the lower buying, lower selling activity in the market as households sort of sit back and buy, in many cases, not by choice.
That's because of job insecurity. Thousands of Canadians are out of work, and that uncertainty is putting real estate dreams on hold.
I have advised my clients who do live in their properties that this is not the time to list. Even though we are in the spring market when most people do want to list, and this is statistically the most active time of year, we are just going to hold tight until people can start going out of their homes and doing tours again.
And incredible views. So this is the new reality, being the looky-loo online while stuck at home, waiting to sell or buy a new home. Robin Gill, Global News, Vancouver.
Still ahead, the humans on the other end of these life-saving machines. COVID-19 primarily attacks the lungs, and many patients often have to be ventilated to recover. That not only requires the machinery to do it, but the very specialized skills of respiratory therapists who have to treat every case that comes in. Paul Johnson reports on these critically important frontline workers.
I would say we probably have the most hands-on contact with the patient.
Meet Sapan Behar. Respiratory therapists, RTs, as they're known in the medical community, are some of the most important caregivers that you may not have heard of for a pandemic like this.
The moment a patient comes into the hospital who's presumptive positive, we would be there assessing the patient.
Life for an RT right now means long hours and intense focus on safety and hygiene. Behar says he washes his hands about 100 times a day right now.
We're right at the head of the bed, right? Like that's the danger zone, right? That's where most of the droplet particles are going to be if a patient sneezes or coughs.
We hear a lot about the need for ventilators, which are a precious commodity right now. But the other side of that is the people who run those machines, and those would be respiratory therapists. So the safety and security of those healthcare practitioners is critical right now.
Personally, this is my opinion, the weak link is going to be the number of RTs. You know, how many we can bring in.
Behar says each RT can take care of about 4 or 5 patients on ventilators at any given time. But since the expectation is that each COVID-19 patient who requires ventilation may need it for 10 days, a surge of cases at the same time would be a major challenge. He can only promise he and his colleagues will do their best.
I want to assure the public that, no matter, how big or small the shortage of RTs is, we will get it done.
Paul Johnson, Global News.
Coping through cooking, cardio, and card games. Popular pandemic pastimes. Next. If you're staying home because of the COVID-19 pandemic, you are not alone. More than 1/5 of the world's population is stuck within the 4 walls of their homes, either voluntarily or by force. Reggie Cicchini reports on how we're adapting to this new but temporary way of life behind closed doors.
As COVID-19 concerns impose social distancing on billions of people, the one thing we all have in common is time. And for many, it needs to be occupied. So we're all on a journey to figure out ways to make better use of it.
Welcome to #Dancing with Debbie Allen.
Like joining celebrities offering a personal dance party, or trying to lose yourself page after page after page.
Keeping a routine as much as you can is really great.
Isolation life has turned our homes into a map as we try to search for something new.
This is an opportunity again for us to exhibit some patience.
In a fast food and takeout world, many people have forgotten the simple art of preparing a meal.
Cooking is really, I say, a sensual experience. You taste it, you touch it, you smell it, you see it. But when you can connect with people, the experience you have around it, I think that's what's really brought people together.
Now, it's not just ingredients that are testing our creative sides.
There's one on abstract painting. There was one on making plastic sculptures.
The Vancouver Art Gallery helping people turn their living room into a virtual studio.
Museums do more than preserve the past through objects. I think we play a very important role in shaping the future in our digital offerings.
While other famous museums bring their collections to a virtual audience. Finding childcare in a world of social distancing can also be a challenge, so kids are now learning the ups and downs of being home more often. Others are getting lost in the world of make-believe.
You're probably cozied up at home with your families.
Library systems like the one in Calgary offering story time and a chance to keep students interested in reading. Companies are also taking advantage of people's free time, some putting computer science coding classes into the palms of future coders' hands. And as the world watches the seconds tick by, waiting for some kind of good news, our homes provide us with new opportunities to reconnect with ourselves and our families. And who knows, self-isolation could also lead to a boom. In 2033, we may have a whole new group of teenagers known as Generation Quarantine. Reggie Cicchini, Global News, Washington.
That is Global National for this Saturday. I'm Colleen Christie. Tonight, we leave you with a new version of Canada's favorite pastime. Call it isolation hockey. A group of friends put together this penalty-free, socially distanced game, passing toilet paper from coast to coast to coast. Hope it's not their last roll, and hope you're finding ways to stay connected while staying at home. Thanks for watching, and stay well.